Communication between dispatchers, ambulance providers, and the emergency room is not an option when it comes to heart attacks. The technology is reaching another milestone these days with an app called eBridge now being used at both hospitals in Evansville. Eyewitness News' Katie Forcade takes us for a ride of a simulated response to a heart attack patient to show us how this works.
When 911 is called over a possible heart attack, time is of the essence.
EMS arrives and assesses the patient, does an EKG, and usually diagnoses the heart attack in the field. Then the patient is transported to the emergency department where they're diverted into the emergency department. Another EKG is performed and the patient is assessed by the ER doctor.
Ascension St. Vincent medical staff and EMS workers in the tri-state are now working around that protocol by implementing a new app used on a smartphone. EMS workers took us through a simulated experience with an acting patient going through a heart attack where an EKG was performed.
We were able to use that data through the eBridge app that we have hooked up with St. Vincent, send the information to the hospital, which then alerted the ER to call for cath lab to be ready.
Avoiding that extra trip through the emergency room. Officials say this works to help solidify partnership with EMS workers and hospital staff.
It allows them to see what we see. It allows them to understand what we're trying to tell them in a more realistic manner.
And most importantly, providing better care to those patients.
And the quicker that we can get the patient care, the quicker we get that artery open, the better they are.
In Evansville, Katie Forcade, Eyewitness News.
And we contacted Deaconess Health System officials. Deaconess also has the eBridge app utilized by its emergency rooms.